Radiation is one of the 3 ways people are treated for cancer. But how does radiation work, and is it safe? We are learning more about radiation today. We welcome in Dr. Spears, a radiation oncologist with the Cancer Center of Hawaii. Hello, thank you so much for joining us.
Thank you for having me.
So, Doctor, you are a radiation oncologist. Can you explain what that means?
Well, radiation is one of the 3 ways we treat cancer patients. The other 2 are surgery and chemotherapy, which most people are more familiar with. Many people know that chemotherapy is medicine that goes into every cell in the body, where surgery is targeted to just one area. I often tell patients that radiation is more similar to surgery, except while a surgeon makes a physical opening to see and remove a tumor, we use pictures such as CAT scans to design the treatment to target just one area. So the side effects will be related to just that area as well.
Okay, and are the side effects the same for everybody?
No, it varies from person to person. There's actually a huge amount of research looking into what causes patients to have one side effect versus another. So that's still an area of intense investigation.
Okay. Now, I know when people hear the word radiation, they immediately assume it's not safe, and maybe that's why they would choose not to seek that treatment. And then I also heard, could it cause heart disease? What is your reaction to that?
Well, that's a great question, and that's been something that's happened just in the past 5 years that people have really been asking that question in depth. So, yes, as we get better at treating cancer more effectively, we have to focus on making it safer, because patients ultimately are living longer with the side effects from treatment. There have been data that have shown that increased radiation dose to the heart increases your risk of coronary artery disease, heart attacks, and even death.
Okay, oh no. So are there ways to reduce that risk?
Absolutely. So the first thing I would tell patients is that the increased risk of radiation heart disease occurs when you increase your dose to the heart. And many of the older studies that we've mentioned used older methods to treat the chest that were much less targeted than our methods today. Secondly, your pre-treatment cardiac risk factors such as smoking, coronary artery disease, and other lung disease can increase your radiation heart disease risk. So patients can do their part by seeing their primary doctor or cardiologist, or quitting smoking, and eating a heart-healthy diet.
Okay.
And third, if you have no radiation risk factors, or if you have no cardiac risk factors rather, then your absolute risk is really very low. For example, going from 4% to 5% after treatment in a 50-year-old woman.
Okay, so that's important. I mean, a lot of people may say, "Oh, well, what can I do? I have no control." But that's not true. If you don't smoke, if you have a healthy diet, all of those things can reduce your risk.
Those are very important.
Okay, all right. Is there anything you can do as their radiation oncologist to reduce their risk further?
Thankfully, yes. We have newer technologies now that allow us to treat a breast or a lung tumor better than ever before. Things like taking a 4D CAT scan that follows your heartbeat and your breathing patterns during treatment, so we can see how everything moves and can compensate for that accordingly. Secondly, we have treatments where women can lay on their breast if they have breast cancer, and that allows the tumor to fall farther from the heart. Or we can have women hold their breath so that there's more space in between the tumor and the heart, which we can use to our benefit as a buffer. And finally, there's more and more data showing exactly which dose levels the heart can tolerate, and that gives us a metric that we can plan the treatment around. So treatment is now safer than it ever has been before for the patient.
Okay, that's great. I know people who actually prefer radiation over chemo because they didn't get real sick like they did with chemo. And then also, I think when you go in for radiation treatment, it's shorter times, right?
Exactly. You've hit on 2 of the upsides. Of course, I don't want to knock on my medical oncologist colleagues. It really depends on the type of chemotherapy that's given. But in general, I compare radiation to going up a set of stairs. So every day you get a very short dose and a small dose, and you go up another step. And it's not until the end of the treatment that the side effects tend to be maximal, but that's also when the cancer cells have seen the full effect of the radiation, and that's when they start to die.
Okay, thank you for explaining that in a way that I think people can understand, all people, because I know, with all these medical terms and when you have cancer, It's hard. It's devastating.
Absolutely.
And there's so much information out there. So thank you for explaining all of that. And you're with the Cancer Center of Hawaii.
I am.
Right? Okay.
Yes.
And they have great technology there as well.